I suppose I'll start with some of the more easily recognizable things that a person would subjectively experience in anticipatory grief. So sadness is an obvious one, and feelings of depression, loss of interest in things that were meaningful to you or brought you joy and happiness and comfort. All those things can kind of lose their flavor. We can end up finding that those things that were so meaningful to us before and so important to us before suddenly aren't. All those things that brought us so much joy and comfort and excitement in our lives, those things just don't anymore. In terms of, I think it's also useful to look at physical symptoms, which are really common. So some common ones would be pain in the stomach, or a feeling of hollowness, tightness in the chest, sometimes palpitations, difficulty breathing, appetite changes, really common, difficulty sleeping. That's more of a behavioral thing, but again, something that physically manifests with somebody. As far as the behavioral things, again, you often don't have any energy, or you become overactive. So again, it's kind of a confusing topic to talk about because there's no universal way that grief expresses itself. But these are some of the more common manifestations. In terms of cognitive symptoms, people often find that they're absent-minded, they feel confused, preoccupied with the death of a loved one or a friend, and there's often a lot of mental rehearsal happening. They're rehearsing the death. What's it going to be like when this person dies? What's my life going to look like? How am I going to cope with all this? And I should say that none of these in themselves are pathological or wrong, but they can be distressing. There are other reactions that are also common, but less easy to understand for the person themselves and can cause them a lot of distress. So one of the most common ones would be guilt and shame. And you might ask yourself, but why would someone feel guilty or ashamed when someone they love is dying? And there could be a lot of answers to that, but usually it's that the person is having responses that don't match up with the stereotypes of grief or the way that we see it portrayed in films or the way that we think about it. This again goes back to that point that I made about us not being comfortable with death, not talking about death, not knowing how to grieve or sharing it with other people. So again, perhaps you might have a feeling that you just want it to be over. And you can feel really bad about that, going, well, does that mean I want my mum to die? No, of course you don't. But that suffering that you're witnessing can be so overwhelming that sometimes there may be this feeling of, oh, it'll be such a relief when it's over. And then you feel guilty about that, or you feel ashamed about that. These are really, really common experiences, and I always encourage people to be kind with themselves, be patient with themselves. Another really common experience is that of anger. The person is angry with themselves, they're angry with the person who's ill for being ill, and it's a kind of an irrational anger. They will say to themselves, it's an irrational, why? It's not their fault that they're ill, but yet you feel angry towards them. Another very common one is feeling angry at God or at life for allowing this to happen, feeling sad and sort of pitying yourself. I don't like that word, but I think we all understand what I'm getting at there, which is that you kind of feel sorry for yourself. What did I do to deserve this? Why is this happening to me? These are all very, very common experiences. So anger, aggressiveness can come out, which seems like the last appropriate emotion to come out in a situation like this. But again, as I said, very common and understandable when you realize that what this is pointing towards is a lot of pain and sadness around this. Grief and anger often go together, sadness and anger. I always look at patients, or when I speak to patients, I ask them, I sense that there's a lot of anger underneath this sadness, or there's a lot of sadness underneath this anger. Those two just seem to go together a lot of the time. Then there's withdrawal. People withdraw emotionally or physically from the situation. They don't know what to do. They don't know how to handle it. They're afraid of making things worse. They don't know what to say. Or they even just shut down emotionally completely. They feel numb. They can't feel anything at all about the situation. And that can again bring up guilt and shame. Why am I not feeling about this? Why am I keeping my distance from someone that I love so much? So it can be very confusing for the family members and for the person themselves who is going through the illness, or is anticipating their own death. It's been so many times that I've had patients who talked to me and said, I thought John, Sarah and Peter would be there for me when this happened. And then when this awful thing happens to them, this atom bomb goes off in your life, suddenly all the people that you thought were going to be there for you just scatter to the wind. And very often it's people that they didn't expect to be there for them that reach out and that support them. So it can be enormously disruptive to your relationships with people, and people, as I said, to withdraw from the situation emotionally or physically is a very common response. But not a very helpful one. So you as a healthcare professional, it can be very important for you to be aware of this and to be able to point this out to people when they're experiencing these kinds of confusing feelings and behaviors in themselves or from people around them. Well, there is no universal way to experience grief, and anticipatory grief can be a problem if it has overwhelmingly destructive effects on your life and your functioning and your relationship with the person. I think the two most commonly experienced ones, and that I've had experience with, is that sense of misdirected anger that people struggle with. They're angry at the system, they're angry at themselves, they're angry at what's happening, and sometimes that can be directed at the staff or the people who are most trying to help them. The other one is, as I said, complete sort of emotional or physical withdrawal. And then finally, something to look out for is substance misuse, which can be quite common and an understandable way to try and cope. But there are no hard and fast rules, because grief can manifest in so many different ways. And something may seem very destructive, but it's a short-term coping mechanism and the person will sort of stabilize over time. So again, keeping in touch with the situation over time is probably the best way to deal with that. When you start seeing patterns of people being overwhelmed and not coping with what's going on. There's some factors involved in how anticipatory grief is experienced and plays out. I'd say the first is the type of illness, the situational aspects of it. So let's say something like dementia or cancer might have quite a long, uncertain period where we don't know what's going to happen next, where there's still a lot of hope that the person may get better, or that we don't know when. We know the end is coming, but we don't know when that's going to be. That's quite different from someone who has a sudden illness or a sudden accident. So that is one of the factors that can sort of moderate how intense the anticipatory grief is. Another important aspect would be the level of acceptance that the person has. And I think acceptance kind of gets a bad rap, this word, oh, we should accept things. Acceptance does not mean that you should like something or that you enjoy it. Simply that you allow it. Simply that you are kind of dealing with reality on its own terms. And it can actually be something that's very freeing. It can free up a lot of resources, mental resources, emotional resources, when you are not constantly fighting what's happening. That does not mean that you are giving in. That does not mean that you are giving up. But finding a level of acceptance with what is happening can actually help you cope much better with the situation. I think we have a tendency, particularly in the West, to fight something at all costs. We often talk about illnesses as battles, and a lot of people don't like that terminology with it. Some people talk about illness or death more as an uninvited guest. You should sit down and have tea with Mara, as the Buddhists would say. They're an uninvited guests, but it's still our party. And that's an attitude that people often develop in the course of a long illness. But for other people, it's very important to keep on fighting and to fight right to the end and to never give up. There is no universal way that works well for everybody. So I think to answer the general question of whether anticipatory grief is a problem, no, it is a very normal human experience, and it's an expected human experience. And like everything else in our lives, good and bad, it's how we deal with it that determines how the situation and its outcomes affect us. So I'd like to talk a little bit further about the effects of the type of illness that a person has. So when we're treating someone medically, it can have all kinds of physical and emotional effects on someone. And as an example, I'll talk about something that happened to me when my father was very ill in hospital and it was clear that he was going to die. He had to have a tracheostomy. So he lost the ability to speak with us, and that actually made the anticipatory grief so much harder because we couldn't do any of the things that you'd want to do. Communicate with someone, plan with them, think about what's going to happen afterwards. And it was actually made the whole experience a lot sadder and more difficult for the whole family, because although he was there and he could respond with his eyes, he couldn't use his voice anymore. And so a lot of the time we're left wondering, what is this person thinking? What do they want? What do they need? So there are always these factors that can make it really complicated. I'll use another example, dementia. So the person's memory may go, their sense of identity may go. And people who care for people who have dementia often talk about there being a lot of little deaths, about this person being taken from you a piece at a time. So those are some examples of the actual effects of the particular type of illness that can really complicate the anticipatory grief and the process of coming to terms with the end of the life of a loved one.